with Chris Shalda from Cortec Services and Rebecca Kwasny from Total Solutions. During today's session, we'll be discussing how Office 365 is transforming healthcare. My name is Karen Shalda, and I will be moderating today's session. Before we get started, there's just a few housekeeping items to address. Today's webinar is being recorded, and it will be available to you after the session. We encourage you to participate in today's webinar and like to make the session interactive, so feel free to ask questions during the session. You can enter them in the question box. We will also be holding a Q&A session at the end, and we can just get started. Rebecca, take it away.
All right, great, thanks. So just to give you guys a little introduction on myself and Chris, I am Rebecca Kwasny. I'm a SharePoint consultant here at Total Solutions. I've been here for over 3 years, and I actually came up to IT a little bit awkwardly. I came up through with a law degree and then moved into IT from there. And actually when I was in law school and getting my law degree, and for a while there afterwards, I was working mostly with health law and the healthcare industry, focusing on the management of electronic records in healthcare. And today I'm going to focus on talking about some of the improvements to productivity that Office 365 can provide healthcare organizations. Chris?
Thank you, Rebecca. I'm going to be here and talking about this subject. It's top of mind for a lot of healthcare organizations. I'm Chris Shalda, I'm Microsoft Solutions Architect for Cortec Services. I have been with Cortec for about 9.5 years now. I've been doing mostly on the consulting side, working from small to large organizations. And a lot of what we do at Cortec is working with healthcare organizations. So we have a lot of experience for some of the largest healthcare organizations in the nation. So we have a lot of insights in terms of some of the challenges that they have, and especially we're talking about Office 365 and cloud services. So I'll be focusing in on that today. So looking forward to it.
So just to run through the agenda here again really quick, we're going to do a brief little intro here on Total Solutions and Cortec and the partnership that we have. And then I'm going to speak to you guys a little bit about Office 365 and how it's actually transforming the healthcare industry. And then Chris is going to talk to you about overcoming some of the challenges with moving to the cloud, particularly with addressing kind of the HIPAA security and privacy requirements specific to healthcare industries. So to give you a little bit of background on Total Solutions, we are an Office 365 and SharePoint consulting and custom development firm. And we've been working in IT, specifically in this space, for about a little over 20 years. We're based outside of Metro Detroit. And we actually have clients that range from healthcare organizations to higher education institutions, international government agencies, and Fortune 100 organizations.
Yep. And yeah, Cortec Services, we are an IT professional services consulting organization, and we specialize in a lot of different areas, a lot around virtualization where it comes to server and desktop virtualization, virtual desktop environments, either on-prem or in the cloud, with mobile device management, general infrastructure consulting, and project management, as well as, of course, all the other cloud, Microsoft, like we're going to be talking about today, and migrations as well as another big thing that we do, whether it's desktop migrations, server migrations, application migrations. We definitely have a lot of experience there. We're headquartered in Farmington Hills, Michigan, not too far away from Total Solutions, so we work very close together with them. We provide services all over the globe, and I've been founded in 2006. And in a little bit more about our partnership, I mean, Total Solutions is, yeah, I think we're going to get to that one next, actually, so let's go ahead, Rebecca.
Yeah, so Cortec and Total Solutions focus mostly when working together on enhancing business productivity for our clients. And we really try to do this mostly in the healthcare industry. As Chris said, they have a lot of healthcare clients and can do a lot of the high-level IT stuff. And we are a relatively SharePoint specific or Office 365 specific shop. And so we can come in and help with some of those more specific cases or use cases where they need to use some of those technologies.
Yeah, and to add on to that, it's just we've had a wonderful relationship with Total Solutions over the past years here and work together. They're really just an extension of Cortec as it comes to really those things that specialize in that Cortec doesn't necessarily specialize in. So yeah, the SharePoint development work, app development work, they do a phenomenal job, and yeah, we're glad to be partners with them.
We love you too, Chris. So now getting into why we're really here. So as of early 2016, Gartner basically did a survey and found that roughly 78% of enterprises either are or are planning to use Office 365. And they determined that even for the remaining 22%, it's no longer a question of whether they're going to implement Office 365 services, it's a question of which ones, in what order, and how. And this is because Office 365 is now a unified cloud-based platform, and Microsoft is using it to deliver all of its newest features for its collaboration, communication, content, and social offices offerings, giving your users kind of that ability to work how they want and where they want, using systems that all interact with each other. And having these fewer systems being able to work how they want and when they want is really going to increase the productivity of these users, because they're going to be able to access real-time information more accurately and making it much easier to find that. And they're actually going to be able to collaborate on that information. But with this increase in productivity, you do have to weigh this against the security concerns with such an open cloud-based system. And we see those concerns most commonly among the healthcare industries, because, especially with the healthcare industry, because they have to adhere to all these strict compliance regulations around HIPAA and PHI. And it can cause a lot of hesitancy there. So we're going to talk about some of these benefits and hopefully waylay some of these concerns. So one of the main benefits you're going to get with Office 365 is around this collaboration of the different users that you have. One example of that is Yammer, which is actually a private social network that can help your organization and the people within it stay in touch and up to date on the latest information. For instance, you could create a Yammer group specific to a discipline, like a group for speech pathologists, where they can actually collaborate and share information just relevant to their line of work. And they'll be able to share things like articles, ideas, and successful or unsuccessful treatment plans right in real time, helping to improve your patient care. And the goal with Yammer is really to empower your employees to connect with the right people for the information that they need at the right time. You can also have shared workspaces, specifically for patient collaboration. And this is actually using one of the big use cases here is with a new feature from Microsoft called Office 365 Groups. And what Groups is actually a highly secure and simple way to share files, emails, notes, and calendars across care teams and even amongst outside providers and the patient themselves. And all of these members of the group are going to be able to access the relevant information about the patient's case, including any historical communications leading up to when they potentially join the group. So groups are a little bit easier to show, so I'm going to jump over into a demo here and kind of walk through some of these features. And while I'm doing that, one of the really nice things about they aren't something that have to be created by IT. Users can actually create them right here in the Outlook web app, or even using one of the mobile apps if you're on the go. So this is just an example of a group that I created for a potential fake patient here. And you can see that what I'm actually looking at on this group site is a new private modern SharePoint site collection. And I have a document library and a notebook for all of the kind of documents or any notes that we want to take. But we also have kind of this news feed at the top. And these are just little notes, and I've used the example of patient visit notes, where I can actually quickly track just the little notes about the patient's visit, not just for myself, but also for other providers that might be involved in the case. So you can see here that there might have been a provider who uploaded some x-ray results to the document library and included their notes on the findings here, as well as the x-ray right on the page. There we go. So in addition to this site, you're going to get a group mailbox, which is actually going to let you have complete conversations with everyone in the group and maintain that entire conversation history. And it can be accessed directly here in the Outlook web app or via any of the mobile apps. And since this is an Exchange mailbox, you're actually also getting a full-powered Exchange calendar where you could potentially set up appointments with the patient or look into scheduling additional care with other members of the care team. And since this can be shared with external users and you can have your patients actually come in and join, you're going to help keep your patients more informed and involved in their care. Now I did talk about, so that's kind of groups, and I did want to show you guys really quick my example of Yammer here. So here we have a Yammer group from general medical discussions where you can see that a user's just kind of asking for some advice on her case. And that they can actually come in here and have some quick diagnoses. You can have tags and topics to help track this. I mean, this way your providers can, again, stay really up to date on that, the most relevant things to them, because they are able to join these groups ad hoc and leave them ad hoc, assuming they are public groups. Now, groups can be public or private, and a public group can be joined by anyone in the organization, where a private group for a private group, the users have to actually request to join, and then the owner of the group would have to approve them. So with all of these increased collaboration methods, this is also going to help you bring in some of your remote workers. Because of the collaboration, those easy sites that are available anywhere on the web, you do have the access to all of that real-time information. But you also have Skype for Business, which is going to allow you to communicate over IMs, voice, video conferencing, and even web conferencing. And with the connectivity option, or the Skype connectivity, you can actually connect with anyone that has Skype for Business, Skype, or Link. And this includes the consumer version of Link, which will enable that same connectivity and communication for patients, family members, and other members outside of the healthcare system. So this can be especially useful when you're trying to, increase the facility's capacity, because you can actually have your administrators potentially working from home while still staying seamlessly connected to their data. And for clinicians, you could actually potentially increase the number of patients that they're able to see by providing the virtual appointments. And this connection to the entire clinical ecosystem is really going to help improve your patient care by keeping all members of the patient team on the same page regardless of where they work or who they work for. But it's really not only important for the clinicians and care teams to stay connected with patients and each other, but it's also important for them to stay connected with the organization as a whole. And I know this is especially difficult with remote workers, but even with staff that works on site, the time you have traveling between meetings, especially on medical campuses that can be extremely large, or even just across multiple buildings, and how many meetings I know that doctors can have within a day, you get a lot of that kind of physician burnout. And in fact, according to the Mayo Clinic, 46% of their surveyed physicians had at least one symptom of burnout. And one of the benefits of Office 365 is you don't have to do quite as much as that up and moving around to have these meetings. You can actually add participants in the browser, create Skype meetings in Outlook, and with the HD video capabilities, it's sharp enough that you can actually see facial expressions and review imaging results in great detail, like right as if you were in the room looking at them. And this ad hoc desktop sharing is actually going to help you speed up the typical meeting process, because you're no longer waiting to have someone's screen be brought up or have to start a meeting with that screen share capabilities. It's all rolled into that one application. So all this together with the collaboration features can really help the healthcare executives better engage with the entire care team, regardless of the location, to build community, culture, and engagement. But the care teams can also better relay back concerns, opinions, and ideas directly to those key decision makers. So productivity and stuff is great, but one of the big drivers of Office 365 is that it is extremely cost effective. By reducing the number of redundant solutions and kind of just consolidating down those disparate tools, you're actually going to reduce operational costs by allowing your IT employees to focus a lot more on revenue generating and patient-related technologies, especially since Microsoft's going to be managing the maintenance issues and upgrades while still providing you with that kind of a central dashboard by which to monitor and manage any of your entire ecosystem. And with the 99% money-backed uptime guarantee, you can be really confident that the systems that your teams need and are using are always up and running. So just to give you a couple case studies here, Advocate Healthcare actually saved over $4 million by switching to Exchange Online, and they're expecting to save another $1 million per year by moving to SharePoint Online. And similarly, another organization was actually, another hospital was actually able to reduce their IT costs by over 50% due to uninterrupted email service and enhanced collaboration capabilities. So those are some of the benefits of Office 365, specifically with healthcare, within the healthcare industry. And Chris is going to talk about overcoming some of the challenges with moving to such a platform.
Yeah. Thank you, Rebecca. Just come up here. Perfect. So yeah, thank you for that, Rebecca. And there's a lot of really great examples of how this cloud service can really improve overall operational efficiency, productivity between end users, IT, and just the organization as a whole. And so that's one side of the conversation, and there's a lot of organizations that are excited about that. But we do work with healthcare organizations, like I said, small and large. And one of the things that definitely comes up as a theme is, in terms of challenges, is security and compliance and how all that works. Because, the cloud is different than what you would not necessarily put on-prem, like your own Exchange servers, your own SharePoint servers, file servers, that type of thing, where yeah, you have a certain amount of control, and maybe policies are built around that. You're just used to having that type of control internally. But with the cloud, with Office 365, there's so many more things that can allow for more productivity, but at the same time, maybe the security has to be looked at maybe a little differently, because it is a service that's being provided. You're not going to be providing the infrastructure, setting up the infrastructure. You're just subscribing to a service which holds your data. And there are actually some very interesting ways that Microsoft has gone about this in order to ensure that integrated across all of Office 365, there are security controls, auditing, compliance controls for that, along with some of the other pieces that we'll talk about later of that tie into Office 365 very seamlessly to help ensure that you have that type of security. Because it really comes down to, no matter what solution, and especially traditional solutions on-prem, you had to make a choice of, are we going to make this really, really highly secure, and then maybe not, users not being as productive, for example, file shares or even emails that the users can only get to it on-prem. They have to be on a very specific network to get to it. Can't get to it outside the network on whatever device they want. So productivity suffers, but security is paramount. So it's very highly secure. Or the other side of it, which is you want users to be productive, and you provide all sorts of access to the data and information applications that the users need, but may not consider all the security side of it, and that might suffer. So it's usually a give or take, a push or pull with that in terms of security or productivity. And a lot of organizations struggle with that. Now, I think Microsoft has done a very all these integrated solutions to ensure that it's not an or conversation, it's an and conversation, security and productivity. And when you use these technologies that Microsoft has seamlessly integrated with Office 365, you're able to get both. And hopefully we can give you a few examples of that so you can see that in action as well. But what really starts with is trust, because you're not going to be hosting the infrastructure. You're not going to be controlling the network within Office 365. It's presented as a service to you and your end users. So you have to have a certain amount of trust to be able to go forward with that, and Microsoft knows that. They've spent a lot of money, a lot of investments ensuring that there is trust there, not only from making sure that your services are going to be highly available with minimal downtime. They do have that financially backed SLA that Rebecca mentioned, and that they're also going to provide these services at a global scale, which is very difficult for many organizations to do because it's very costly. But at the same time, ensuring that they're secure, that the data is private, that they're adhering to compliance and regulatory bodies, and that all that information is transparent to you and your IT organization across those security, privacy, and compliance, so that you can validate that Microsoft is truly taking care of your data, and as someone that you can trust their service. And so they put together a trust center where they pull together all of the different trust documents and compliance regulations that they abide by, all the reporting that they've gone through in one place, so that you can go one place and see and get all the information and ensure that you can trust them. They want to make sure that that is the case. So that's usually one of the first conversations we have is when looking at Office 365. And I know a lot of organizations have already purchased Office 365, but it might be hesitant. So this still could be something that seeing that information and trusting that Microsoft is taking care of their data really help them to move forward and take advantage of the investments that they've made. And I'll show a little bit on those trust documents in just a bit. And so we talked about collaboration and communication, sharing of documents, and working together on different documents. But the idea is that with Microsoft, they've provided a way to share those documents securely, working on them, collaborating securely, especially when there's sensitive information. Now, you may not have, not all documents are going to have sensitive information, so there are different mechanisms to ensure that that the users don't make mistakes in terms of unintentionally sharing something that's sensitive without having it maybe encrypted, but also empowers the users to make some of those decisions themselves on how sensitive that information is, because they know that information the best, and all that's audited as well and can be tracked. So OneDrive for Business is one of those pieces that's tied to SharePoint Online. It's actually kind of one and the same service, and we'll see OneDrive for Business is kind of like your personal home drive that each user would have their own location for that, so they can get to their files from anywhere on any device. And then SharePoint is more, if you think about it as your file shares for your department, your teams, maybe the organization. Of course, you can do a lot more SharePoint, but that's in terms of where the files are at and how they're shared. But these files from, like, let's say a OneDrive, for example, there's a good, like discharge summaries is a prime example. Since discharge summaries are often only available on site, physicians rush through them at the end of the day, and sometimes that can create opportunities for errors or missed summaries. And with OneDrive for Business, physicians can then access these summaries from anywhere on any device, which give them the time they need to review the summaries in detail, minimizing those mistakes. And also, there's capabilities of sending modern attachments, which would enable physicians to email approved summaries back to the appropriate nurses without having to worry about setting individual permissions. So it's actually getting away from sending these, a file to everybody that's, and you're going to have different versions. It's actually linking back to a file that's located within a OneDrive that is then in one central location. And at the same time, that means that IT can have the control over that information because it's still sitting there within the OneDrive, which is under IT control. So that's just a couple examples there from secure sharing. And so some other things here too is that you can actually manage the rights of the information that you're sharing from the file level and the documents, where either automatically or manually from a user. You could assign the rights to a specific document and allow only certain users to even open it or just be able to view and not edit. And nobody else will be able to open that file. And those protections actually follow the file around no matter how it's shared, through email, through a sharing link, through SharePoint, put on a USB drive, that type of thing. That file protection follows that file around, and just make sure that things like email attachments are highly secure and that only the right people that are intended to have that access to that document can open it. So that's just one of those things that's very integrated into Office 365. I have a little demo to show on that later on. But in general, that's one way to ensure that information is protected, and that ties in with data loss prevention, which can automatically classify some of these documents as with their sensitivity level based off of the information that's in it, whether it's patient health information, social security numbers, driver's license numbers, credit card numbers, any of that information can be flagged from data loss prevention when that file is being shared, and automatically protect that with encrypting it before it gets sent out, or even blocking it altogether, because maybe some users shouldn't be sharing that information at all. So very highly integrated into the solution with Office 365. And healthcare compliance, right? That is a big deal. That is on top of mind for many of these called CXOs out there for the healthcare organizations, because it can be very expensive if information is leaked out, patient health information, especially. Each record costs a certain amount of money from a fine perspective, but then there's untold damage to the reputation of your organization and a lot of other consequences to any of that sort of data leakage. And in general, organizations then, they know this and they spend a lot of time trying to do what they can to preventively reduce the penalties and being caught by any of that data being leaked out. So spending a lot of time and efforts into ensuring that that information is locked down and secure and compliant. Well, with Office 365, it really ensures that the CXOs can spend a lot less time on these IT solutions, making sure they're compliant, and more time on those revenue-generating activities. And that's just because a lot of these are built into the service, and you don't have to really maintain the infrastructure to ensure that these are in place. And those are things that are protecting patient data, like that data loss prevention I talked about, advanced threat protection, which from an email standpoint, it protects against those like phishing, spear phishing you might have heard of, and kind of steal your users' credentials. It protects attachments from malware, and also makes sure that links to websites are safe when they're opened by users in their email. And also, this Office 365 allows those CXOs to respond to any sort of legal requests in a very efficient manner and very completely with advanced e-discovery capabilities throughout the entire service. So that's not only your emails, but any files that are stored in OneDrive for Business, SharePoint Online, conversations in Skype for Business. It's one place that centrally you're able to perform the advanced e-discovery across the entire service for any sort of legal cases that come out, which really just significantly reduces the time to prepare that type of information for, if something like that should occur. And this is covered under, from a healthcare compliance standpoint, like you said, is Office 365, but also other components that Microsoft has, which tie in nicely, which is the enterprise mobility and security and some of the Windows Azure core services. Everything is covered under HIPAA, and Microsoft has documentation to prove that to the organizations, and also is covered under many other regulatory bodies, especially in the European Union as well. And so what it comes down to is that you can then deploy a more secure, private, and compliant solution and ensure that patient data is secure, complying with the regulations, which in turn, then from an IT perspective, allows them to spend less time implementing point solutions that address security, privacy, and compliance programs, when they now can focus more on improving the healthcare and the end patient care and indirectly, right, and also other revenue generating projects instead of just having to deal with security and compliance concerns and not moving forward from there. And then that reduces the compliance fines and gives you confidence, gives confidence to clinicians about the IT solutions that the data that for their patients is safe as well. So one thing I want to show here is the Office 365 Trust Center, and this part of it is within an Office 365 tenant. I'm going to show just some of the transparency from Microsoft of what they include in one place here. So to begin with, you go in and you determine what region you're in and what industry you're in, and that helps to filter out the compliance documents and trust documents from what is most relevant to you. So in this case, I said North American healthcare. So then I bring up the compliance reports. And these are the governance, risk, and compliance summary reports. And as you can see, there's a lot. So you're seeing we've got PCI, and let's see, I know there's HIPAAs in here as well. And that shows some of those assessment reports that they're protected, and it proves that. And these are some of the ISO standards as well, if you're bound by those. Also the SOC type of reports. So it shows the assessments where Microsoft is. This is a third party that's doing the assessments so that you can have that in that trust that they're protecting your data and abiding by the regulations here. And then we have the trust documents provided by Microsoft. And a lot of these are guidance and also description of what they're doing with their service to ensure privacy and compliance and security, how they're implementing HIPAA for their service is an example there. And then some of the risk management reports of what they've done in terms of security assessments as well. So that's included within Office 365 tenant, so you can check out that there. And next, I want to just touch on, this is an interesting feature that is, it ties into Office 365. It is part of the Enterprise Mobility and Security Suite, and this is an example of how closely these two products are tied together, these services are tied together. So let me just pull that open in here. And so Cloud App Security, this is actually a service that was purchased by, basically, an organization that was bought out by Microsoft, and they've brought it in now under that Enterprise Mobility and Security, also known as EMS suite. And what this does is this gives you visibility into all of the different cloud applications that are in use in your organization. It ties in directly to Office 365 and some other applications that from a data level to see what's going on inside of each of those applications from a standpoint of what information is being shared, whether it trips any kind of DLP rules. So for example, it's monitoring a lot of activities and files. It found that there's some specific information here that's on a SharePoint site that has PII information. Now that doesn't necessarily mean it's shared out, but is just alerting you. So this provides notifications and alerts real time, as well as it can give you a capability to take action on certain basically issues or notifications that are brought up to maybe suspend a user account, so block their user account or reset their password. Maybe something's strange like a user account's being logged into, in Michigan and then across the world and like Russia 5 minutes later. Well, that's kind of strange. That would be surfaced here, and you can take some action from that. Any other anomalous activity from logging in. Maybe a user's downloaded like a couple hundred gigs of information from SharePoint. Well, that might be something that's not probably legitimate, most likely, so that would be surfaced here and can show you what's happening there, giving you those reports and allowing you to take action on that. This also can connect to on-prem firewalls and proxy services in order to look at the traffic that's going in and out of your network and see what other cloud apps are being used by your users, surfacing it all here. It actually can identify over 13,000 applications, and it's growing, and helps you to identify the risks of those and relatively to know whether that's an application that shouldn't be used in your environment, whether it should be unsanctioned or whether it's a sanctioned app. You can take different actions on those. It maybe just gives you insights into knowing what your users are doing. Maybe they're using other file sharing services and they didn't realize that you have OneDrive and SharePoint online. So you can provide some user education for them to use those services so that you can keep control of your data and that information, just keep it protected. And there's also capabilities of blocking some of those other non-sanctioned apps. So for an example, I'll show some of these apps here. Some of like the risk factors, they break it down automatically. There's some default ratings for each of these cloud applications. And so they get rated on, different security, compliance rules, that type of thing. You can adjust these as you see fit, set your own thresholds, and add your own applications into here. And there's just a lot of information that's pulled in. Activity log from across Office 365 and these other cloud apps. So, who's logging where, what files are accessed, what files are shared. You can see what admins to see if something strange is happening, track back some activities, seeing where users are accessing this information from. So a lot of information in one spot, and it makes it really nice with this, with some policies and templates they already have built in to find some of this risky activity and do something about it. Very hard to do otherwise without some sort of solution like this. And then lastly, wanted to show a little bit about what Microsoft's doing about sharing sensitive files securely and some of these newer capabilities that they've been building in. So like I said, there's some capabilities from an automated encryption and securing files. Let's see, that would be under, which is under here. From a DLP perspective, so data loss prevention, what Microsoft's done is that this is across the board. So remember, I keep saying across the entire service. So it's not just Exchange Online or SharePoint Online or OneDrive Business. They've done a lot to centralize, whether it's compliance or these DLP rules and encryption across all the services, e-discovery, so that you don't have to go to multiple places for that. So data loss prevention, they've kind of rolled up into one. I've added kind of a test policy here. And this can track all sorts of different, there's 81, I think, templates right now of different types of information that can be tracked in kind of content within documents and emails. And you can create your own custom DLP policies. This one's on HIPAA, so I'm just kind of click into here real quick. As you can see, it's actually protecting, so Exchange Online, SharePoint Online, OneDrive, and you can do specific sites, and this actually brings up a good point. You can have specific sites, especially in SharePoint Online, that have different sensitivity levels of, you're telling the users, well, this is more of a public site, you shouldn't have any sensitive information here, so maybe the sharing is okay to share from there, but maybe you have another site that's has a lot of patient information, a lot more sensitive confidential information, so you can put different controls around that site and those files so that you can have a lot more stringent security around the information that's stored there and shared from there. So very customizable. In this case, where this is the HIPAA rule, so what it's doing is looking at social security numbers, the DEA numbers here, and seeing how many of these instances are in the content that somebody's trying to share, and looking at condition-wise whether it's share with somebody outside the organization. Then you can take action on it, and this is all about notifying, educating. So maybe notifying the site owner from SharePoint that somebody's trying to share out this sensitive information and shouldn't. Maybe puts a policy tip, which is just a little message that comes up in your application. Maybe it's Office like Outlook or Excel or even on the web Office 365 portal. It says, hey, this information is sensitive. Did you really intend to send this, right? Just because a lot of times this information is sent unintentionally and non-maliciously, and just the users are not thinking about it, they're just trying to get their job done. And you can have it completely blocked at that point if it doesn't match a rule, or maybe you allow some users to override that, provide a business justification even. But that type of information is then audited and can be reported on in incident reports. So very customizable, and this just allows you to give the users a little bit more capabilities of using files, sharing files, but putting in guardrails to protect that sensitive information. You don't have to lock down everything, but have those policies in place that if something is identified as sensitive, then take some action on it, which really allows to remove some of that friction from those users' experience there. So another thing that Microsoft has done is they're making it, they said, a little bit more in the user control to, because they know, this more so than maybe an IT administrator. IT administrator can't know what's in every single file out there that the organization uses. So there's another acquisition Microsoft purchased recently, which puts in this little bar here in the Office applications, which might be new to some of you. So this allows the users to set the sensitivity on their own. A certain with enterprise mobility and security, one of the packages allows you to just have the user set this on their own and curate that on their own. The step up from that one allows you to set automatic policies that based on the content will set this for you. And this tag follows the content, follows the file. So whether this file is going through Office 365 and the DLP engines there, or you have third-party products that are using for email hygiene, email encryption, or even other types of DLP technologies, it can interpret this and take action on that. So Microsoft, again, is doing a lot to enable users to do this, and they're working a lot with third-party companies to make sure their products work very well together. So you can set this as, this is sales information, this might be confidential information. You can set it so that when you, if you try to kind of go down the level, let's say, from a sensitivity level, that you can enforce a business justification of why are you setting this to a new sensitivity level, or just block it altogether based off of the users that are doing this type of thing. So this is a lot more easier for a user to understand this than some of the older ways of encrypting documents and classifying, labeling documents. So that's one thing there. And within Outlook, which I know Exchange Online is typically one of the first workloads that many organizations look at with Office 365. So, and especially with healthcare, it's all about encrypting files, making sure they're protected. So you usually have some sort of an email encryption capabilities, regardless of where you're coming from. Within Outlook in Office 365, you can do things that are built right in when you're creating new emails. So you can say, you can do a do not forward, which will block anybody from forwarding that email, even taking a screenshot of it. And you can also protect it with different policies that you might have within your organization, depending on how confidential that information is. And that will apply to the message itself and the attachments there. So trying to make it very easy for users to do that right. But at the same time, again, there are automated policies that if maybe there's content in there that trips HIPAA, Social Security numbers, PHI, that can be automatically encrypted based off of rules that you set, and also allow you to do encryption of emails that for people that are outside of your organization, so they don't have to have a special email application or like an encryption application to open up the information. They can just get to it from a web browser. So a lot of great capabilities that are just built in, and usually just a couple clicks away from configuring that across the entire service. So a lot of great stuff that Microsoft is integrating and trying to make it easier for the users to do the right thing and to keep that information protected. So let me just go back here to the exit presentation. There we go. And another thing too with the securing files, I mean, you're talking about you have different types of devices, mobile devices. You might have your corporate-owned devices that are Windows. You might have your own devices. And there are different ways to protect the data on each of those. Microsoft has done a great job of tying that all together once again to ensure that the data can be protected and only is able to be shared within sanctioned applications. And that's something that's new on the Windows side with Windows 10 and Windows 10 Enterprise, which kind of brings us to Secure Productive Enterprise. This is a new licensing suite from Microsoft that really ties together that security and productivity side of the conversation. With these products all work better together and tie in very deeply with each other. We talked about Office 365, the EMS with the security capabilities, and now with Windows 10 Enterprise too. Everything ties together. Windows 10 can be locked down much like a mobile device now, and protecting the data from going from a business application to a non-business application. Can't copy and paste from one to the other, for example. A lot of things that Microsoft has worked on integrating together. And yeah, this is just something that should be looked at. And talk to your Microsoft account executive about this for more details. We'd be happy to answer some questions for you. Something definitely to consider because it's all these pieces together really work best if they're all working in unison. It would provide a great experience for end users and ensure the IT control. And so once you're looking at Office 365 or maybe and haven't purchased, I know a lot of organizations have, and you haven't started to to adopt it, to migrate to it yet, not sure where to go, what to do first, there's a great opportunity to use this. This is one of our workshops that Forte can put on. It's a customer immersion experience. And what it is, it's a hands-on experience with real devices set up with a Office 365 tenant, with all sorts of data that is day in the life. And we walk through scenarios of your organization and how users might collaborate or communicate or work on documents together and see what Office 365 has to offer if it's a fully implemented solution, so that you can really determine, based off of how you work today, what are the features that you really gravitate towards that are really critical to your organization, and that helps to prioritize where to go first and where to get started. And another thing too is if once you have Office 365, maybe you started implementing it, but you want to maximize the value of it. Value Discovery Workshop is another option that we offer, which allows you to look at the priorities from your organization and with those modern capabilities from Office 365, and make sure we're prioritizing what you want to do first and what you need to implement, looking at the bigger picture. And what we see, what Microsoft's seen from these workshops is that it significantly reduces the decision-making time of what to do next and how to implement, because you get all the right people together. You reduce a lot of the data breaches because you're talking about security, you're talking about the big picture. And in general, it just improves productivity. So another great option that we're able to offer too. It's been very successful. So with that, I guess we're going to go to questions that we might have had during this. So let's just take a second. If anybody has any questions, you can put them into the chat window. And okay, it's like I have a question here, so it's a good question. Is if we have SharePoint on-prem already, and we have Office 365 though, can take advantage of the security features that we talked about. So that is a good question. There are a lot of capabilities within SharePoint depending on how late your version is, let's say how recent your version is, where you can take advantage of some of those capabilities, but it really is better either when you're in a hybrid situation, when you're connecting on-prem to the SharePoint Online, or when you put everything into SharePoint Online, where you get a lot more of those capabilities and insights into the security auditing controls and in a central location. So you can use SharePoint on-prem with SharePoint Online. I'd encourage you to maybe put in a plan to start migrating some of that information up to SharePoint Online and maybe set up a hybrid for that in the meantime. All right, let's see if we have another question here. If here's another good one too is, okay, so we're talking about mobile device management, and this person said that their organization has a third-party mobile device management option, and they're wondering if that would still work with Office 365. So that's a very good question. So that actually is possible to work with Office 365. Now, one key thing is that only Microsoft Intune, the mobile device management from Microsoft, is able to manage the Office mobile applications. So that being said, Intune can take over the mobile device management in general, or can do what they call mobile application management, and can actually work alongside your current MDM solution so that you can manage those Office applications while you're still using your existing third-party MDM solution. So Microsoft, again, is trying to do their best to work with other vendors and third parties, but still add value to their applications as well. And one key point, too, is that for those Office 365 applications, in order to use those on a mobile device, you have to have certain Office 365 subscription levels. So like, if you're like an E3 or an E5, then you can edit documents on your mobile devices. That's something that you can't do if you just have your traditional types of licenses just that you use on-prem. All right, looks like we got another question here. How many organizations do you see moving to the cloud? Oh, that's a good one too. Rebecca, you want to maybe field that one?
Sure. We actually see a majority of the organizations we're working with moving to the cloud. If not in full, then at least in part, like as Chris was mentioning, with a hybrid implementation of some sort. So they are getting a lot of the benefits of having the mobile applications while still having some of the added security that they want by maintaining some stuff on-prem.
Very good. Very good. So I think that's all the questions that we had. And yep, so thank you, Rebecca, for joining us. And actually, could you put up the last slide there, Rebecca, real quick? Just going to switch over here if we can.
Sorry, minor technical difficulties. 1 second.
All right. So we had a little bit of contact information that'll go into the recording. But yeah, please reach out to us if you have any questions. Want to learn more about how Office 365 can benefit your organization. You maybe want to start planning for some migrations. We're definitely willing to help with that. And again, thank you, Rebecca, for joining us, and thank everybody else for joining us today and taking some time out. I hope you have a great day.
You too, Chris. Bye.